Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting on the WFMP 106.5 Forward Radio Community Network in Louisville, Kentucky, where news, information, and entertainment is available 24 hours a day, 7 days a week. The views and opinions expressed on our show are those of the speakers and not the station. Single Payer Radio is a project of Kentuckians for Single Payer Healthcare in conjunction with Physicians for a National Health Program through its Kentucky chapter. We produce this program because we believe healthcare is a human right and we advocate for a national, not for profit, publicly funded, single payer healthcare system. We refer to it as Enhanced Medicare for All, covering dental, vision, hearing, prescriptions, and long term care, starting at birth and covering everyone. Catch our programs at 2 p.m. Monday, 7 a.m. Tuesday, and 11 a.m. on Wednesday. We also stream our show on SoundCloud so you can listen anytime. This radio station relies on volunteers like me and your ideas and donations to keep us on the air. Today, Doctors Mike Flynn and Gene Shively join me as co-hosts, and the topic is gun violence. Let's get started. Dr. Flynn?
This is Michael Flynn. I'm a retired surgical oncologist from the Department of Surgery at University of Louisville. And let me begin with the usual disclaimer that any comments I make represent my personal views and do not represent the views of the Department of Surgery or the University of Louisville. Now, I want to make another disclaimer as well. Our topic today will be gun violence, and we have a very special guest, which I will introduce in a moment, who is both a gun violence victim and a survivor. But I want to make these comments, and I'll explain why when I'm finished. Number one, I am a registered Republican. Number two, I am a gun owner. Number three, I was in the Navy for 20 years, a retired naval officer. And during that time, I spent much of my training with the Marine Corps and earned a number of marksmanship ribbons. And I'm not saying this to brag. I just want to make this comment so that I cannot be accused of being some sort of radical left-wing anti-gun nut. Gene?
My name is Eugene Shavely. I'm a retired general surgeon. I practice rural surgery in Campbellsville, Kentucky at Taylor Regional Hospital. And I had a close relationship on the clinical staff at the University of Louisville. What I say is that of my own and does not represent the views of the University of Louisville or Taylor Regional Hospital. I'm also a gun owner. I spent 2 years in the United States Air Force as a flight surgeon.
Okay, our topic today is gun violence, and we have a very special guest, Whitney Austin. She is as I mentioned before, a gun violence victim and a survivor, and she was shot multiple times in 2018 at the Fifth Third Bank in Cincinnati. She has become an advocate for some issues related to gun control and opposition to gun violence. She's the executive director and the co-founder of Whitney Strong. Ms. Austin, thank you again for coming on here to talk about this important issue, which is literally an insane problem in this country compared to other first world countries who do sensible things about this. So we're going to give you an opportunity to make whatever comments you'd like to make for as long as you'd like to make them. If you're comfortable talking about your personal experience, that would be fine. I think our listeners would appreciate that. And perhaps you might even talk a little bit about the the organization that you're founded. So the floor is yours.
Thank you very much, Dr. Flynn. My name is Whitney Austin, and I am at this point very comfortable with sharing my story because it was more than 7 years ago, and I've done it quite a bit. So practice is helpful. But most importantly, the end of my story ends with everything I ever wanted and gratitude. And so I call that out right from the beginning because I do think it is much easier for survivors to share their story when it ends in that way versus the many people I know involved in this work who are doing it because of a loss. So my story started in back in 2018. It was September 6th, and I was an employee of Fifth Third Bank and had almost 16 years at the bank. I loved my job. It's headquartered in Cincinnati, Ohio, and one of the projects I was leading required me to be in Cincinnati a lot. So it's not abnormal for me to be there. It's the opposite. Get in the car at 7 o'clock and drive up 71 and be there in time to start the day at 9. And so on that day, that was the plan. There was nothing abnormal about it. I talked to some of my colleagues. I listened to a podcast. And as I descended into the city, I needed to connect to a conference call with my legal and compliance partners. And I always share that detail because a call with them meant I was paying extra attention. And so I joined the call. I parked in the parking garage and continued the call as I walked out of the garage across Fifth Street and onto Fountain Square, where our corporate headquarters reside. And I did actually think about one risk, and that was getting hit by a car as I crossed Fifth Street while I was multitasking. But that was really the only risk I thought I needed to be concerned about. And so as I got up to the revolving door that I always use to go in, I noticed that there was some shattered glass in the door, but it was still intact. And I just for a split second thought, that's weird. I wonder why it looks like that. But never assumed that it was because of bullets or that I was in grave danger. And so I kept on that conference call and I pushed the revolving door like I always did to go inside. And then that's when the first barrage of bullets hit me. And at first, I wasn't quite sure what was happening. I thought that, I knew that I had been injured, but I felt a burning sensation all over my body and I couldn't figure out exactly what it was. I knew that nobody was close enough to me to have punched me or stabbed me. And then I leapt to, well, these must be bullets that are going through my body. That must be why I feel this sensation. And then the next leap my brain took was, and this has to be a mass shooting because there was really no other explanation for why I would be under fire in my workplace. And so I then started to think about my family. My little girl was 5 and my little boy was 7, and my husband, and how I just needed to live. I had to get back home to them. They would not be okay at this fragile age without a mother. I needed to get home. And so I started to think through my options for survival. And at that moment, I noticed that nobody was on the square, which is something I probably would have noticed if I wasn't multitasking as I went to the building. I also tried to get up, but my arms were too badly damaged to push myself off the ground, so that wasn't going to work. And then the last idea I had was to find my phone that I had lost, during the first barrage and call 911 to get someone there to rescue me. And when I went to move my arm to try to get to my phone, that's when the next barrage of bullets came. And I consider myself someone, I consider myself to be a problem solver. There's there's very little that I can't figure out. And I remember thinking in that moment that I can't figure this out. The only option I have left is to play dead and to pray. And that's what I did. And on a dime, the Cincinnati police arrived. And it's also helpful to know that from the moment I took the first bullet to the time Cincinnati police arrived was exactly 1 minute. So I just told you a lot of things, but they happened very, very quickly. And so as soon as they arrived, they had been trained to know what to do in this situation, and they did everything exactly right. And it makes me emotional to think about how I got the very best of them that day. And we know that in other situations of mass violence, particularly what happened at Uvalde, those precious and innocent children got the opposite of law enforcement. And so it's one of the many blessings that I count that I got heroes that day. And so they did what they had been trained to do. They killed the shooter. They rescued me from the revolving door. They brought me out onto the square. I actually walked from the revolving door to the bench where they placed me because all of the bullets had hit me from the belly button up. And I laid there. Well, they did first aid to the best of their ability, waiting for the ambulance and EMS. They put tourniquets on me, although I don't remember that. I just now know that after the fact. And they did their best to just try to make me as comfortable as possible until I got on that ambulance and they took me away to University Hospital. And things started to get fuzzy from that moment on. And really fast forwarding to what I remember is waking up in the hospital and seeing my husband, who had driven like a bat out of hell from Louisville to Cincinnati to be with me. My parents did as well. But I remember seeing my husband, and I remember seeing all of the nurses and the doctors who all looked like angels to me and said, "You're a miracle. You were shot 12 times, but none of the bullets hit any major organs or arteries." And that's all I needed to hear. That is all I prayed for and all I had hoped for in that moment. And to hear it, it was just the best news I had ever received. And so it's more than just that. I was so stable that they didn't need to operate on me until the next day, which I did go on to have many surgeries for, and blood transfusions, but it really was the best of the worst situation. And I'll never forget that. There are no days that pass in my life that I don't recognize that all of this is bonus time. And that is what, in those early moments in the hospital room, led my husband Waller and I to say, well, we can't just take this gift and move on. We have to do something about gun violence. And so we decided right then and there in the hospital room that we were going to be on the side of trying to prevent gun violence. We didn't know what we were going to do because I was a banker and my husband is an artist. But we were very firm in our values, and our values then are still our values today. And they are, we seek common ground. We're not here for the politics of all of this. We're here for progress, because it didn't matter when I was in that revolving door that I was a registered Republican or that we owned guns or the opposite of those things. All that mattered is that I was facing a life or death situation and I needed to get home to my babies. And I want to make sure that we're on the side of trying to prevent that all over the country.
Well, thank you very much for that statement, and I'm sure our listeners are learning a lot. Gene, do you want to begin the conversation?
Yes, sir. Whitney, that was a very vivid explanation of what happened. I can't imagine being in that situation. Can you tell us a little bit about what your organization does? And then after that, tell us, the audience, what we can do to help your organization and what we can do to try to prevent gun violence.
Yeah, thank you for asking. So, our organization is called Whitney Strong, and our mission statement is finding common ground to end gun violence through data-driven, responsible gun ownership solutions. And as I mentioned already, that common ground part is really important to us. We have a very diverse group of supporters, and that's, of course, where people sit politically, but also gun owners and non-gun owners, and diversity in terms of race, ethnicity, which plays into oftentimes what form of gun violence hits you, but also diversity in religion and values and all kinds of things. And so um, I'm really proud that we've been able to build a safe place for all humans. And so what we do, we have two different organizations now, the Whitney Strong organization and then the Legislative Fund. And I'll start with the former first. I remember in the early stages of all of this, we had some visits from politicians, and they were very kind to provide us policy docs and help us understand what policies could make a difference on this issue. But I didn't come in ignorant of politics and knew that whatever policy we would pursue was going to be a long road ahead. And I remember this visual of me, sitting there with my hands in handcuffs and thinking, if we only pursue policy change, it's like living in handcuffs. And that's not enough for me because every single day someone is dying in our state. In fact, every 10 hours, someone dies of a gun related death. And if our only solution is policy, this is going to keep going, for 5, 10, maybe 15 years. So, what can we do on a daily basis that isn't dictated by what politicians say or do, but can affect change? And this is really what the public health approach is all about. It's not about one single thing that ends gun violence or any other public health issue. It's about many things coming together. And so we started to explore different evidence based trainings that exist. And we knew we wanted to get at all sides of gun violence. 64% of gun deaths in Kentucky are suicide. So if you're looking to materially reduce that number, you're going to have something that gets at suicide. And so we landed on one suicide prevention course for adults. It's called Question, Persuade, Refer, and it teaches people the warning signs of suicide. It makes them practice through role playing how to have a conversation with someone who is suicidal. And it makes sure that they are educated on their local mental health resources, because unless you are a mental health professional, you're going to need to tap out at some point because you don't have that expertise. So that was one of the first ones we brought out, and it's called QPR. We also then got into Stop the Bleed, which you may know about. It was started by the American College of Surgeons soon after the Sandy Hook massacre, because they went back and looked at the incident and realized they could have saved more children if there were tourniquets in the classroom. And it's actually a military training, which makes a ton of sense, being overseas and fighting, that you don't have a hospital at every moment to solve for trauma. To me, it feels a bit damning and depressing to think that we needed it stateside, but we do. And so, because it was one of the tactics that was used to help save my life, and because University Hospital in Cincinnati was so keen to get it out there, I said, sure, let's do that one too. So we offer Stop the Bleed. And then lastly, we wanted to get at what true responsible gun ownership looks like. So it's unfortunately just not a requirement anymore in our state that if you get a concealed carry permit, that you have to go through any form of training. I do know gun owners that go through training on their own, and good for them, but it's too easy in 2025 Kentucky to just walk in with a gun and walk out with a gun and not be required to go through any sort of training. So what does firearm safety look like, both from a handling perspective and from secure storage? Because we know that secure storage is one of the most important things people can do to prevent unintentional shootings and suicides. And so we came up with our own firearm safety course called The Strong Rules of Firearm Safety. And it's really more geared toward new gun owners, first time gun owners that just haven't taken the steps to go through any course at a range. And so those are the three trainings that we offer. We actually are about to launch our fourth, which is a suicide prevention course for youth. We know that our firearm suicide rate with youth in Kentucky has increased by more than 50% in the last decade. And so we've got to be on the side of making sure that our youth are gaining access to sources of strength and resiliency. And that is what the course is all about. It's called Strength in Community. And we're really excited to be the first organization in the country to be able to offer the community model of it. Sources of Strength is a SAMHSA endorsed youth suicide prevention curriculum. And again, we're offering the first community model version of it. And so with our trainings, which all feed up under the umbrella of our Save a Life program, we are doing it in multiple places across Kentucky. Being a data-driven organization, we go where people need us most. So the trainings in Louisville, Kentucky are offered in 10 neighborhoods only, and those are the neighborhoods with the highest number of shootings. Most of them are in the West End, but not exclusively. Newburgh, for example, is one that is not there. Outside of Louisville, we have the training happening in different rural areas as well. And I know rural is a continuum, right? So I'm about to say rural, and who knows, Dr. Shively, you may say, nope, that's not rural. But we are in the Horseshoe below Jefferson County as well. So we are in Bullitt, Shelby, Nelson, and Hardin offering the trainings. And the reason we're in those counties is because firearm suicide rates are elevated in rural areas. And so the vision is that Save a Life would grow to all the counties across Kentucky that need us most. And right now we're sitting at more than 3,500 people trained, more than 50,000 gun locks distributed, and also really good outcomes in terms of increases in knowledge and comfort with the topic. We send all of our participant data to the University of Cincinnati for analysis. So that's the 501c3, Whitney Strong. And you can see we are not handcuffed. We are doing trainings every week, and we are making a difference with behavior change. And then the other side of the coin is the legislative fund. And I'm happy to elaborate on that more depending upon what questions you have. But this is the more long-term play, which is knowing that policy change is a long road, but once it goes into effect, it will change thousands and thousands of lives. We had almost 850 people die of gun violence in 2023. A policy change is something that will make a material dent in a number like that. And so when it comes to the policies that we champion and then work within our state capital in Frankfort, they are always policies that have bipartisan support. So you won't see Whitney Strong getting involved in legislation in Frankfort unless we truly have representation from both sides of the aisle. And the reason we do that is one, that's the practical way of handling this. We're not going to see change if only the Democratic Party gets involved in Frankfort. And then secondly, because I come from a place of believing that, there are different perspectives, and the way that people see and use guns in the city is different than the way people see and use guns in rural areas. And I think that we need to hold space for both of those. And so the solutions that can garner bipartisan support are probably the ones that are best for Kentucky. So headed into 2026, we have a couple of policies that we will focus on. And if that's where your conversation wants to go next, I'm happy to talk more about them.
Well,
Well,
let me ask you then specifically, what kind of recommendations would you make if you had the opportunity to make tell the legislature what they need to do to reduce gun violence in Kentucky? Just outline the specific recommendations that you think should be made by the legislature to reduce gun violence in Kentucky. Are you comfortable
So
with that question?
sure. So to clarify, this is my dream, not what's rooted in reality.
No,
Is
I
that right?
understand. I understand. That's what we want to talk about this, and I want our listeners to hear your thoughts about what the legislature should be doing. Because I think one of the major issues we have in this state is the fact that I don't know what's going on in the heads of the legislators when it comes to guns in Kentucky.
Well, if we're playing, the blue sky game of I can come up with anything I want and we could make it
Yes, yes,
happen,
indeed.
then then there are a couple of policies that I want. And one is a secure storage bill. So unfortunately, we haven't researched gun violence prevention solutions the way we should, and there's a reason for that. We really only have about a decade's worth of research, and that's because the Dickey Amendment was passed at the federal level, which said we can't research gun violence because when we do, it'll just lead to gun control and we can't have gun control. And interestingly, Dickey, who was behind it, before his death, he shared that he was regretful for being behind that effort.
Yes, yes, that's
Now,
correct.
we did see in 2021 things change, and it was really exciting. It was a bipartisan effort at the federal level to fund research on gun violence again, and it was at least 25 million. It may have been more that was dedicated to research through the NIH and CDC, which was a really exciting time. And a lot of those studies are starting to, the reports, the report out on them, those reports are starting to come out. But because of that, we just don't know with conclusive evidence, for example, what policies would make a difference for more than just a few. But one we do know has conclusive evidence that this policy will reduce unintentional shootings and youth suicide is secure storage. And so the way these bills work, and of course, some states have them and states like Kentucky don't, is that mostly they're written that if there are children in the home and the firearm is not on your person, then it needs to be secure. And secure means that your unloaded firearm is locked in a separate location from your ammunition, which is also locked. And so because we have that conclusive evidence and because I'm a mother who thinks of children first, I want that done. I don't think it's unreasonable. And I think again, if you're not using your firearm, if you're not carrying it, then the safe and responsible thing to do is to make sure that it is secure in your home so that we can protect our children. So that's one, but that is definitely a blue sky conversation because that is not a policy that's being discussed in Frankfurt right now. The second one is what we refer to as a temporary transfer law, and we have been championing it for the last 6 years. It's called Crisis Aversion and Rights Retention, CARR for short. And when we say temporary transfer, what we mean is that people are going, specifically gun owners, are experiencing crisis moments all across our state. Now, it may be that they're experiencing a crisis that makes them want to kill themselves, or it may be that they're experiencing a crisis and they want to kill others. But the data tells us, by the way, that if you want to kill others, you also most often want to kill yourself. So there's some overlap there. And unless you're someone who is prohibited because of a felony or because of an involuntary commitment, or domestic violence, there are some prohibitions that exist at the federal level. You can buy a gun and you can have a gun, you can possess a gun. And so it is that combination of intent to harm self or others and easy access to firearms that leads to suicide and mass violence and other forms of gun violence as well. But these policies were created to mostly focus on preventing suicides and mass violence. And so, what I would want is a temporary transfer law that would allow someone in crisis to go through a civil process. So, this is not criminal. No one is charging you and taking you to prison. We're here to get you help and to press pause and to make sure that while you go through this crisis, you do not have access to firearms. And what temporary transfer laws do is use our courts and law enforcement to remove firearms from the home when someone is in crisis. So I would really want both of those done. And I think it would go after, potentially separate things. There is some overlap with suicide, but secure storage would go a long way to keeping our kids safe, and temporary transfer laws would go a long way to preventing crisis moments. Again, the majority of which would be suicide, but also any mass violence that is brewing.
Let me ask you this question. There are a lot of people who feel that carrying a gun prevents violence, that if you get involved in a situation where somebody's shooting, if you're carrying a gun, you can stop it. And there's also a lot of people who feel that having police officers in the schools with weapons that will prevent mass shootings. Do you have any? What's your opinion about that? And if there's any evidence, let us know.
Now back to we haven't studied things enough. Those are two areas that we haven't studied enough. When it comes to, being a good guy with a gun, I do think that there really aren't a whole lot of good faith actors out there trying to compile that data. There are people who are on the side of Second Amendment or bust. I kind of say, like, I will never be for any changes to firearm related laws that are compiling data, but they aren't doing it in a good faith way that leads people to believe the validity of their data. And then on the reverse side, which is often more of the anti-gun crowd, there's no incentive for them to track when firearms are used successfully for defensive purposes. So I'll be honest and say that I don't really trust that data. I haven't seen any good faith actors get behind trying to compile that, with the exception of my good friend Mark Bryant, who runs the Gun Violence Archive in Lexington. If you don't know about that resource, they're combing to the best of their ability through news articles, social media, et cetera, to try to document every incident of gun violence. And so I do think he's out there working on that and doing it in a good faith way. But a lot of the other names that you hear, I wouldn't trust them. It would be a great study, and I wish someone would commission it. I think when it comes to people being good guys with a gun, absolutely, there are good guys with guns. I'm alive because of good guys and gals with guns. But think about the training requirements that are put on law enforcement before they're allowed to carry, and then the ongoing training requirements as they continue in the force. And so, if I could wave my wand, Dr. Flynn, and get my third magical policy, it would be that there are training requirements to be a gun owner, in the same way that you must go through a test. And that's both a written test and a driving test to be someone who drives an automobile in our state. That we would go through a similar set of parameters before you could be a gun owner who is carrying a gun outside of your home. So that's a long way of saying I'm just not sure that the research is where it needs to be on whether defensive gun use is happening all that frequently. And I think in addition to doing the research, it would be really, really beneficial if we could pass a law in Kentucky that would have some sort of licensing or training requirements for people before they walk outside of the home and they carry a firearm. I'm
Well,
sorry, you brought up a second example that wasn't defensive gun use. What was it?
Um, Police officers in schools to try to prevent mass casualties and other violence in the schools. And should they carry guns?
Yeah, I was going to say this is one that I've looked into some too, and the research is not very robust. We can, of course, anecdotally think of instances in which they did make a difference and instances in which they didn't. And so I'll use we need to research it more to really know.
well, in my opinion, there's a lot of dancing around the real issue, which is access to guns. I don't think it needs a bunch of studies because all you have to do is look around the world to the European Union, the United Kingdom, Canada, Australia, and New Zealand. All of these countries have laws that limit access to guns. I lived in Switzerland for a period of time, and almost every male in Switzerland is a member of the Swiss Army, which is a defensive organization. If you want to buy a gun in Switzerland, you have to go through all of the things that you just talked about. You have to have a background check. You have to have an interview. You have to have training, and you can buy a gun, whatever gun you wanted to buy. If you want to buy another gun, you have to go through the whole process again. You can walk into a store in Texas and buy 12 AR-15s, which is what a lot of people do, put them in a car, drive across the border, and sell them in Mexico to arm the cartels. So, I agree with you about the importance of having, doing the right thing. But as I'm not criticizing you, but I mean, the politicians in this country are a lot of these discussions about gun violence, in my opinion, dance around the issue of access to guns in this country, which is absolutely insane. Second Amendment was written in 1791 when the firearm at the time was a single shot front-loaded handgun, musket, or cannon. The AR-15, if you can pull the trigger fast enough, a bullet comes out every time you pull the trigger. And an 18-year-old now can go into a gun store in Kentucky and buy one of these things without any training at all. That's just, I mean, I don't know where that's all going to go. I think you're doing a great job, and I compliment you. I'm just curious to know where your thoughts are, because I think the legislative issue, until we can get some of these thoughts into the heads of some of these politicians, I don't see this stuff going away.
Oh,
You got
well,
some thoughts about that? I think your organization is exactly what needs to be done, but I don't know how we get into their heads.
well, much of what you said I agree with, but the next thing I'll say is, okay, so what do we do about it? And we've got to find a way to make progress. And a lot of the things that you've suggested just can't happen right now. They did polling after the horrific week that included the Charlie Kirk assassination and the school shooting. And the poll came back with a majority of Americans believe it's more important to prioritize preventing gun violence over prioritizing the Second Amendment. And at first I thought, Oh, I like that headline. Let me look into the data and see where the breaks were by party. And then as I dug into it, I found sadly that 75% of Republicans believe the opposite, that we should prioritize the Second Amendment over preventing gun violence. The reason it landed on the majority is because the Democrats believe in the opposite way, and so do independents. And so back to the what do we do about it? We aren't all on the same page. And that's how government works. Now, that answer is very different than me asking a Republican, do you support temporary transfer? Or do you support secure storage? Or do you prevent keeping guns away from mentally ill people? And you'll see different numbers on all of that. But the point I'm trying to make is we do this together, or we don't do it at all in America. And so there are policies that garner bipartisan support, and those are the ones that our organization chooses to pursue. And then we also believe really strongly in that public health approach, which is why we're going to do those trainings and we're going to distribute thousands of gun locks. And I know that's not as exciting as saying, and we're going to pass 20 policies that we need to pass. But I truly believe that we will eventually. But we've got to open our ears. We've got to tell stories that open people's hearts. And we get them slowly but surely closer to what we believe. And I know that's hard because every 10 hours we lose someone. And I don't know if that person is going to be someone I love or someone I don't know. But I don't know any other route than trying to bring people together and make progress.
Well, I
So
thank you for your activity. We had two pediatric surgeons on to a program a year or so ago, and something that I didn't know at the time was the major cause of death of children in this country is gun violence. It's not measles or automobile accidents, it's gun violence. And I don't know how I'm too old and retired and not in it, but at some point, this information needs to get driven into the brains of the legislators in this country who have this, in my opinion, ideological insanity about the Second Amendment.
Well, I would encourage all of you when we have our Capitol Day in January, which the date has not been set, but you can go to whitneystrong.org and sign up to receive our email communications. You'll get that date, and I would encourage you to come because what we do is we work to schedule meetings with lawmakers. So you as a constituent with your representative and your senator. And then, of course, we say these are our legislative priorities and the talking points that we would like you to use. But it's also your opportunity to speak directly to your lawmaker and say, I am your constituent, and this is the leading cause of death for children and teens in our country. I'm a retired surgeon. Help me understand where you are in getting closer to what I believe.
Now,
And those moments really matter.
Have you done this yet, or this is going to be the first one?
No, we do them every year.
You do?
And
Okay.
so, we usually get between 75 and 100 people there. That's not enough, right? We
Yeah,
should
I
have
agree. Yeah.
thousands of people there considering the frustration and outrage that people have on this issue. So I would encourage you to come. These moments matter.
Well, good.
Let me ask you this question for childhood violence. Should the parents of kids who go out and shoot people and kill people be held liable and criminally liable?
Oh boy, you're asking me a hard question. Hard question.
Well, let me make a comment while you're thinking about it. Gene, I think they should, especially in a situation where like this, I can't remember this kid's name. He had all kinds of violent things going on. in the school. His father took him and bought him a gun. Yeah, yes. I mean, I think their parents, depending upon the specific set of circumstances of things, I think they do need to be held responsible for what a child does.
Yeah, we've seen this, the parents of the school shooter in Oxford, Michigan were
Yes, I
held
think
criminally
that's the one I was
liable,
thinking about.
as well as either it's in consideration or is already finished, the school shooter in Georgia at Appalachia High School. No, I think that it is right for state legislatures to put um, the rules in place, if you will, whereby through our judicial system, you can hold those people accountable. But I'm not comfortable with saying yes 100% of the time because I think the facts really matter. And in those two situations, for sure, in Oxford, I remember those details. It was an egregious lack of responsibility in parenting that led to that situation. And so I am definitely in support of when it is that we have a judicial process that allows us to hold parents accountable. I do
Yeah.
think, though, that there are other circumstances in which it is less so, in which case you wouldn't want to pursue that. So I
No,
don't think it should be all or nothing. I think it should be based upon the facts and the circumstance.
I agree with you. That's a very sensible answer and an entirely appropriate approach.
Wouldn't that be up to the prosecutor and the grand jury, and then if it went on to a trial, the juries to make that determination?
Yeah, I'm not an expert on it, but I definitely know that the way it works in many places is that they are given the opportunity to examine and determine if they want to pursue it, and I like that.
Another issue that I think needs to be addressed, and I'm not exactly sure all of the specific legislative uh, construct, but my understanding in Kentucky, the legislator in its wisdom does not allow the urban areas to have their own gun legislation, which
Yeah.
which is because most of the gun violence, again, in my opinion, happens in urban areas. In Louisville, a lot of it's out in the West End. And I feel strongly that the Louisville and Lexington and Frankfurt and other urban areas should be able to put their own gun laws in place so that they can deal with the issues that are there, as opposed to someone living in Pikeville or someplace like that doesn't deal with the same issues. Your thoughts about that?
Well, first off, we consider suicide part of gun violence, and the majority of gun deaths are suicide, and the majority of suicides are happening in rural versus urban areas. So that is just one correction to make, is that we see more gun deaths outside of urban areas than we do inside. Now, as to where gun laws should be set, it's pretty standard across our country that there's preemption and that the legislature, the state makes the laws, not the cities. It gets further complicated by the fact that there are state laws and then there are federal laws. I agree that there are totally different situations that need to be addressed in a city versus a rural area. But I'm not so sure I'm on board with having a patchwork of gun laws. In fact, my preference would be that we pass all these laws at the federal level. So it doesn't matter. You could be in Hawaii, Massachusetts, or Kentucky, and the rules are the rules. There's no confusion. Um, but that's mostly not the way government works, and state rights are important. And so we've landed on this. It would truly be complicated if we had different rules in Louisville versus Lexington versus Paducah versus Bowling Green. And so I see the other side of the coin, which is there are different circumstances that need to be addressed, but I'm not so sure allowing there to be different rules in each city is the way to go.
I went there just before I retired, there was a surgical grand rounds held by the trauma service at the University of Louisville. So this was about 6 years ago. I don't remember if it was Keith Miller or Matt Benz who did it. And one of the things that I learned, which I was not aware of, was the main gun violence issue in West Louisville, or young males shooting each other, and the main issue of gun deaths in East Louisville with middle-aged men committing suicide. Kind of an interesting observation that I was completely surprised about.
Mm-hmm. Yeah, the common denominator there is men. Men are more often perpetrators and more often victims. Um, so, yep.
Let me ask you a question. Why do you think mass shootings are becoming more common? It seems like we're getting to see one almost every week. Do you think this is due to copycatting, or people who are disturbed, angry about something, that they're copycatting other gun violence? Is it due to mental illness, or why are we increasing the mass shootings in America?
Well, in the first 6 months of the year, we'd actually seen a year-over-year decrease of about 40%. So we were doing great. I mean, I can't say great. There were still some, but a 40% decrease is welcomed. And then starting in June, I mean, really, as we kicked off the summer, like you said, it feels like every week there have been so many, it's hard to keep track of them. What leads someone to be a mass shooter? Again, lack of research, but there is there are two researchers that run the Gun Violence Project. They wrote a wonderful book called How to Stop an Epidemic of Mass Violence. And more than anyone, they do a great job of breaking down all the factors that contribute to someone getting to the place of wanting to commit an act of mass violence. And there are a lot of factors that contribute as to why we see more. You touched on contagion, and contagion is real. It is absolutely real. And the more we see through our media, um, validation of this, the more people are inspired to do it. These researchers behind that book, they talk about it as social proof. So social proof is not a new term. Social proof is everybody in the grade has a Lululemon bag, so I must too. Well, social proof is also when people go through crisis and they can't think of any other way out, what they do in America now is they kill people. That's what they do. And so I am now more justified in doing this than ever before because the media is constantly covering it. And there are places in the internet where I can find a community of people who are also thinking about mass violence, and we're all encouraging each other that this is the next right move for us. And of course, this isn't an overnight thing. These people are being groomed over the course of their, in many instances, young lives, that this is what they're going to be. And so,
Guys, I hate to, excuse me, Whitney, I hate to interrupt, but we're running low on time. We've got about 3 minutes left, so we
All
can.
right, thank you, Paul. I was just about to ask that question.
so social proof is real, and you're right, contagion is playing an effect.
Ms. Austin, I want to thank you for coming on. I think this is going to be a very excellent program for our listeners. As Paul said, we're getting close to the end of the lollipop here. we'll let you have another minute or two to make whatever final comments you'd like, and then we're gonna let Paul take us out.
Well, thank you all very much for having me, and I hope that I opened some minds and some hearts to this conversation. If you want to participate with us, whether it's bringing Save a Life to your community or participating in our legislative efforts, you can go to whitneystrong.org. You can sign up to receive our email communications. You can also sign up to volunteer. And then lastly, if you are on social media, then you can follow us at whitstrong.org.
If I wanted to volunteer, what would that involve?
Everything from assembling kits, so we have our gun safety kits and we have our bleeding control kits, to becoming a trainer. Physicians can be Stop the Bleed trainers, and we pay our trainers to train. To being an advocate who wants to come with us to Frankfurt to speak to lawmakers, or someone who works more in a grassroots way to try to get us audiences across the state where we can talk about the work we're doing in Frankfurt.
Listen, thank you again. Paul, you want to take us out?
Yeah, that we are out of time. So thanks again, Whitney, for joining us. Thanks, Mike and Gene, for hosting and finding this wonderful guest. And a special thanks to our listeners, who without you, our programs would not be possible. This is Paul Hoppy with Kentuckians for Single Payer Healthcare and Forward Radio Broadcasting on 106.5 FM, wishing you a wonderful rest of your day.